However, it can also be systemic, meaning that the disease from elsewhere in the body can also affect the kidneys. Kidney infections are more common in women because UTIs, that is urinary tract infections, are also more common in women. And that's primarily because women have a short urethra, and that makes it easy for infections to get to the bladder. So how does it present? Most of the time, you get pain when you're passing urine. You pass urine frequently. The urine can be bloody or frothy. You get fever and you get pain in your flanks. Let me mention about obstruction because this is very important, especially in men. And one of the causes is prostate enlargement, which I'll mention shortly, kidney stones, and the strictures, that is narrowing of the urethra. So as you can see in this picture, on my left, you have a normal prostate gland. So the bladder outlet is surrounded by the prostate in the first part of the urethra. In a normal person, the urine passes without a problem. But as you get older, in men, the prostate tends to enlarge. And depending on the degree of enlargement, that causes narrowing of the proximal, that is the upper part of the urethra. And that narrowing causes obstruction of urine flow. If this is not addressed, there is a backflow of urine to the ureters and eventually to the kidneys, causing kidney failure. However, remember, prostate enlargement, just as a caveat, is not prostate cancer. Majority of prostate enlargement is age-based without any prostate cancer. We also have kidney stones, which are also unfortunately more common in men. And kidney stones can obstruct, depending on the size, the flow of urine. As you can see on my right, the right kidney has multiple kidney stones, and there is one which is in the upper part of the urethra. This will prevent the urine that is formed in the kidneys from coming out. And the result of that is that the kidneys fail. We also tend to get strictures, especially in men. You can see the normal urethra in the right. There's a clear pathway in the urethra, but in the proximal part of the left urethra, you can see narrowing here and another narrowing at the end. Usually narrowing comes from either procedures done by doctors like catheter insertions if they're traumatic, or in young people infections, especially sexually transmitted infections, if they're not well treated, they can lead to strictures. Now, when you have a stricture, it means the urine cannot come out and it accumulates in the bladder, then also back to the ureters, and eventually it affects the kidney function. Let's talk about chronic kidney disease. This is more common. It's more prevalent in people who are over 60 years old, mainly because they tend to have comorbidities like diabetes, high blood pressure, and they also have a bit more weight. If they have been smoking, the effects of smoking has accumulated over the years. It's also more common in people with family history of kidney disease. I'll mention some of the risk factors which need to be elucidated later. Most people who develop chronic kidney disease don't have any symptoms to start with. And as you'll see in one of my slides, that's why it's important to go for medical checkup. However, as the disease progresses, then you start getting symptoms. By the time you're getting symptoms, your kidneys are probably functioning at around 30%. So what will happen? The first symptoms are reduced urine. That is, however much you drink, you still pass very little amount of urine. You get swelling of the hands, legs, and the face. Usually, what happens is that you wake up in the morning with a swollen face. Then as the day progresses, the swelling of the face goes away and the legs swell. You get very tired for many reasons. One is accumulation of toxins. And two, remember I said the kidneys are also important in production of blood. So most people with chronic kidney disease also become anemic. They'll have low HB levels. And also they are not able to eat well because of the accumulation of urea. So they vomit, they lose weight, they have headaches because of dehydration. Some actually become confused and even they can go into a coma. Because of the accumulation of toxins, most people have severe itching. Remember, these symptoms develop late in the disease. I just put this photo to show the kind of swelling that we are talking about. A lot of patients and people develop leg swelling and they become alarmed that the kidneys have failed. But as you can see in this photo, the swelling of legs from the kidney failure is quite significant. And it has what we call pitting, which means at a level higher up, not at the foot, but in the mid leg. When you press, you leave a dimple in the leg. And this is what I'm talking about, facial swelling. It usually occurs around the eyes only, not in the whole face. Okay, eventually it can go to the whole face, but initially it is around the eyes. Why I decided to put this is because there's a lot of alarm when there's a little swelling of the legs, either from sitting for long or some side effects of some medication, and people start thinking that their kidneys have failed. So how do we manage kidney disease or kidney failure? The primary prevention obviously means that you obviate or minimize the risk of occurrence. And that is by preventing yourself from getting diabetes, hypertension, high uric acid levels. Secondary prevention is early detection and treatment of the chronic kidney disease. This is important because if you have early kidney disease, we can reverse it or we can prevent it from progressing to severe levels where you need further intervention. And tertiary prevention means prevention of progression of the CKD, meaning that you already have chronic kidney disease, but it is an early stage, stage 1 or 2 or 3, but we don't want it to progress to stage 4 or 5 where you have to go for dialysis or kidney transplant. So how do you do primary prevention? You go for checkup so that we can detect the risk factors that can contribute to you getting kidney disease, meaning that we can check your blood pressure and make sure that your pressure is normal and control it, manage your diabetes or detect it early, know your family history so that if you have family, your family has a history of kidney diseases, then you be extra careful to avoid any other risk factor that can contribute. You try to make sure you don't get diabetes, blood pressure, you don't smoke, you eat healthy, you limit the amount of alcohol you take. Prescribe medication. This is very important because some medication contributes to kidney failure, especially over-the-counter medication like painkillers, what we call NSAIDs. They are one of the biggest contributors to kidney failure. We see this a lot in patients with arthritis because they do have to control the pain, and NSAIDs are very effective. So things like diclofenac or brufen will control the pain, but if taken for long and in high doses, then they are going to lead to kidney failure. Of course, if you minimize obesity and you're active in your lifestyle, then you are likely to get diabetes or hypertension, and that protects your kidneys. early detection is very important. So in secondary prevention, we advocate for screening of the presence or risk of kidney disease. And we screen people who are unaware of presence of diabetes or hypertension. And then those who are identified are put on early treatment to make sure they don't progress to kidney failure. Renal replacement therapy is something that I would like to mention because that is the definitive management of kidney failure. And that includes dialysis and kidney transplant. Dialysis is something that everybody dreads, but once you have reached a stage 5 of the kidney disease, that is CKD, then you have to be chronic kidney disease. You either have to be put on dialysis or kidney transplant. However, we also use dialysis for acute kidney injury. And that time it is short term, meaning that we remove the toxins and extra fluid from your body through dialysis, and the body goes through normal homeostasis, and that enables your kidneys to recover. So you may find people who go into maybe shock, maybe they have severe infection, or they were very dehydrated, either from diarrhea or vomiting or blood loss from accidents, and their kidneys shut down. But once we control the infection, once we control the dehydration, once we stem the loss of fluids either by diarrhea or vomiting, and we put the patient on dialysis, the kidneys get a chance to recover, and that dialysis is temporary. However, in the majority of people, the moment they start dialysis, because the kidneys have reached a stage where the changes are not reversible, then the dialysis becomes lifelong. And those are the people we twice weekly or thrice weekly dialysis. The final option, of course, is a kidney transplant. It's being done more frequently nowadays because surgeons have become very good at it, but also because the cases of kidney disease have increased, primarily because we have more cases of hypertension and diabetes. It's a long-term solution. It gives you a chance of not having to go for weekly dialysis. The main challenge currently is in getting a donor, and of course the cost. I think I've already mentioned this, how to prevent. I want to mention a few conditions that are very significant in contributing to chronic kidney disease. The first one is hypertension, which is chronic elevation of blood pressure, where you have a blood pressure above 140, over 90 for a long time. This is usually asymptomatic, and hence the danger, because you can have a high blood pressure for over 20 years without any symptoms. Blood pressure, unlike the common belief, is most of the time asymptomatic. And that makes it very dangerous, because when you don't go for checkups, you can have it for a long time and it's still causing damage and you're not aware. By the time it's causing symptoms, it means you already have complications like kidney failure, heart failure, or stroke. So we should not wait for symptoms to treat blood pressure, and we should not wait for symptoms to diagnose blood pressure. It should be routine screening. Anybody above 40 should be checked regularly for hypertension. The other common cause of chronic kidney disease is diabetes. With the changes in lifestyle, diabetes is becoming more and more common, and also it is coming at a younger age. We are seeing diabetes in people in their early 30s, 40s. Long ago, it used to be a disease of people above 60. We are also, of course, seeing more complications from the diabetes, and that one of the complications is our topic today, kidney failure. However, diabetes has many more complications, unlike hypertension. You get more heart failures, neuropathy, that is nerves, eye complications, and this makes it a bit more severe than hypertension. Also, most people with diabetes tend to develop hypertension. So they have what we call comorbidities, and then they get double complications rate. So the point here is to screen early for the risk factors and also to achieve a lifestyle that can protect you from diabetes. Medical checkups are very important in management of kidney disease and prevention. We do medical checkups mainly for healthy people, people who have no symptoms. When you have a symptom, then we are not doing a medical checkup, we are making a diagnosis. The reason we do medical checkups, it is to detect early silent conditions. These conditions include diabetes, hypertension, kidney disease, heart diseases, high cholesterol, cancer, silent infections like HIV and hepatitis. Most people above 40, we recommend that you go for a medical checkup. And in these medical checkups, you go to a reputable doctor who can be able to know what they are screening for. So what are the indications? Anyone above 40 years, it's recommended. Those who are obese, that is BMI above 30, you should start medical checkup earlier because comorbidities also tend to come earlier, that is diabetes and hypertension. If you have a family history of a chronic disease, then you should do your medical checkups earlier. Unexplained symptoms. If you're suddenly having weight loss, sweating, headaches, please go for a medical checkup. People with toxic habits, people who smoke for long periods, people who are alcoholics, they take excess amount of alcohol, those who lead sedentary lifestyle, they are likely to be obese. Then you should go for a medical checkup. And of course, for insurance purposes, they always do medical checkup, and patients wonder why are we doing medical checkups for insurance. It's because they want to detect these conditions before they take you up on a cover. And finally, let me talk about water. Water is very important in health and also in prevention of kidney disease. I remember what I mentioned earlier, dehydration, loss of fluids, either by vomiting or diarrhea or excessive sweating, can lead to kidney disease. However, people with uric acid also tend to develop stones early if they don't take enough water. Urinary tract infections also tend to occur in people who don't take enough water to flush out the kidneys. So it is important for us to take enough water. But the biggest question is, how much can we take? There is a general recommendation that we should take 8 glasses or more of water. But remember, it also depends on what you're doing. If you're exercising, you're going to get more thirsty. If you're in a hot environment, you're going to get more thirsty. But so 8 glasses may not be enough, or they might be more than enough if you're in cold, well-humid, conditioned environment. So ideally, in addition to making sure that you consciously take water, every time you're thirsty, don't postpone taking water. If you find that your urine is dark in color, very concentrated, take water until it's clear. So we should always aim for clear urine so that we protect ourselves. I think I'll leave it there so that we can have questions and then I can address them. Thank you.
Thank you so much, Daktari, for that session. There's some echo from somewhere. Thank you for that. We already have one question. Are there any long-term consequences of having a kidney stone? If any, which are they? Maybe you can respond to that, Daktari.
Yes, there are long-term consequences of having kidney stones. And the main ones are two. One is that the kidney stones, when they are there in the body for a long time, they can predispose you to infections because it is regarded like a foreign body by your body. So things tend to accumulate where it is, and it also tends to cause denting of the calyces and the urethra. So urine tends to accumulate there, and any stagnant urine is a risk factor for infection. Recurrent infections can predispose you to chronic kidney disease. Of course, if the stones are big, the moment they relocate, they are going to block the ureters. And once the ureters are blocked, then you're going to have an emergency. Very painful. And also, if not addressed, it can lead to kidney failure.
Okay. Sure. Thank you for
Thank
that.
you.
The second question is for a patient with diabetes and CKD, what substance must be reduced in the patient's diet?
Remember, kidneys are used to remove toxins in your body. So in early CKD, we advocate for reduction in protein intake and salt intake. However, once the patient has severe or late stages of CKD, that is chronic kidney disease, they tend to lose a lot of protein and poor absorption, and we have to put them on dialysis, in which case now they need the protein. So early on, you might find us restricting proteins, but later on, once patients are on dialysis, we advise them to take enough proteins. Salt, because of what it does to hypertension, we recommend reduction. Of course, we recommend fruits judiciously, because if taken in excess, they lead to high sugars, but in the right amounts, they protect you. Thank you.
Yeah, before we take the next question, maybe you can elaborate on the stages of when we can say someone kidneys are not functioning. Because I can see the next question is about dialysis. So before even we get there, what are the stages? Yes.
There are many indications for dialysis. One is the stage of kidney disease, and that one we get it by something called GFR, glomerular filtration rate. What we usually do, we do what we call renal function or kidney function test, and usually we get the creatinine level and your age, and we use a formula. So normally the kidney should be operating above 90. So 60 to 90 is stage 1, 30 to 60, stage 2, 10 to 30, stage 4, about less than 10 is stage 5. And that one now is where we start recommending dialysis. So we base it on something called GFR. But remember, if you are not producing urine, for whatever reason, even if your kidneys, the UECs are normal, we are going to put you on dialysis as we try to find out what is causing you not to produce urine, and we correct it. Once you correct it, then the kidneys start functioning normally, and you are off dialysis. Sometimes also you can have high pH level acidosis, and that's not responding to medicine. We have to put you on dialysis. Sometimes you can have electrolyte imbalance, like people with poisoning, and we find them, they have very high potassiums, which are not responding to medicine. Then we put them on dialysis. But in most cases, it is because your GFR is low, it's below 10, and you're not making enough urine. That's when we put you on dialysis. Thank you.
Okay, thank you for that. What test would you recommend for early detection of kidney failure?
The most basic tests are two. One is the kidney function test, what you see as writing as UECs, which means urea, electrolytes, and creatinine. And the other one is a urine test. The urine test is very important, especially for diabetic people, because we check for proteins. People who are diabetic tend to not able to maintain their proteins in the body, so they come out in the urine. Early on, we do what we call microalbumin to detect microscopic levels of albumin. But in late stages, you find that we have macroscopic. So even a simple urine dipstick will detect urine in blood, proteins in blood. So it is urinalysis or urine microalbumin and UECs, that is the kidney function test. Thank you.
Okay. Okay. How long do transplant kidney last? Sorry, how long does transplanted kidney? Yes.
If there are many factors that determine how long they last, but
yeah,
most kidney transplants will last anything above 15, 20, and if well taken care of, even up to 30 years. But the minimum should be 15 to 20 years. Yeah.
So, out of interest, if a client who's or a person already with hypertension and diabetes, if a kidney transplant is done, how sure do we know that that will be taken care of, or how are you going to take care of that kidney that has been transplanted to that person?
The first thing that you need to remember is that if the kidney was transplanted because of diabetes or hypertension, the two have to be controlled to protect that kidney. Otherwise, if your pressure and your diabetes is still not controlled, even the new kidney will get damaged. Number two, there are medicines that are taken to protect that kidney from rejection. So you have to be followed up very strictly to make sure that the levels of those medicine are optimum, and the markers we use to make sure that your kidney rejection is not starting are optimal. So you have to be followed up by a nephrologist on a very regular basis. You have to take your medicine, the anti-rejection medicines, and you have to control the risk factors like diabetes and hypertension so that you protect that kidney. It's a precious one.
Okay. Thank you. Is there any association on swallowing drugs with little water and kidney stones? Maybe that's a myth that you can clarify on.
No, there is no relationship with the amount of water. You can even swallow medicine without water. But remember, the water we are talking about here is for hydration. You must take enough water to make sure your body is well hydrated so that you can prevent things like stones, infections, which can lead to complications in the kidneys. But the amount of water you use to take medicine depends on your comfort. If it's a small tablet, 5 milligrams, 10 milligrams, you don't have to use water. If it's a big tablet, you need water to help it pass. But for water, it's about hydration. Thank you.
Yeah. Sure. There's someone else who just appreciated your good presentation.
Thank you.
That's something I should say before I ask the next question. How do you distinguish renal failure from pre-renal failure?
Okay. Pre-renal failure is still renal failure, but that's a technical term. What we usually say in medicine when we are defining is It can either be pre-renal, renal, or post-renal. Pre-renal is when now you have conditions that are making blood flow to your kidneys inadequate. For example, if you vomit a lot, you become dehydrated. So the blood flowing, the body prioritizes where the blood flow will go, and it is to your brain and the heart. The kidneys are secondary. So the kidneys are denied blood flow, so they shut down. You can also get an accident where you get bleeding and you go into shock. So what does the body do? It prioritizes the brain and the heart, and your kidneys shut down. Same if you have cholera and you diarrhea profusely. So that is pre-renal, renal failure. But it will still lead to kidney failure. Post-renal is when you have things like prostate enlargement or a stricture or a stone blocking the flow of urine, and that now causes backflow of urine. And then renal is where you have a primary kidney disease, like hypertension, diabetes, or infection that primarily affects the kidney. So those are just terms used to differentiate which part of the kidney is causing the problem, and then we can be able to address it more easily. The good thing with pre-renal is that they're easy to correct if you correct what is causing the problem. If it's dehydration, you give fluids and you stop dehydration. If it's blood loss, you transfuse. If it's infection, you manage the infection. So most of the time, it's a reversible cause. Thank you.
Okay, thank you for that. Is a transplant possible at any stage, or are there stages where it is no longer possible?
Transplant are only indicated from stage 5. Stage 1, you can live with it for life without any symptoms, same as stage 2 and even stage 3. The challenge is that we don't want you to progress from one stage to the other because you are inching closer to where you'll need a transplant.
Yeah.
But in stage 1, you'll not even have a single symptom. It will only be detected when you go for a checkup and we discover your creatinine levels are a bit high. But you'll find most people with creatinines of 100 or even 200 survive for life without ever needing any intervention, as long as we control the causative factors. But when you reach stage 5, it means now the kidney function is so minimal that you're not removing toxins, you're not making enough urine, so there's accumulation of fluids in the body. And that now leads you to have symptoms which we don't want. Hence the need for transplant or dialysis.
Yeah. Okay. Is excessive water also bad for kidneys?
Your kidneys can handle liters, more than 18 to 20 liters of water per day. So if they're in healthy condition, there is nothing wrong with taking a lot of water. But it can lead to electrolyte imbalance, like low sodium. So in everything in medicine, we advocate for moderation. If you take too much, it's not good. If you take too little, it's not good. But in terms of kidney function, your kidney can actually remove out more than 20 liters of water in a day, comfortably. Yeah.
Okay. Thank you for that. Do kidney donors have to be relatives of the patient?
Not at all. Kidney donors do not have to be relatives. What we do is we look for compatibility. Before you become a donor, we screen you, and the first criteria is you have to be the same blood group. Then after that, we go for specific antigens, because what we don't want is your body to reject the kidney. So there are specific antigens that we look for that are very volatile in rejection. So you'll find nowadays a lot of kidney donors are not relatives. However, in our situation, we find it easier because we don't have voluntary kidney donors to go for relatives. And also because of the cost involved, it is easier to screen out a relative than a person who is not related to you. But to answer your question, not at all.
Okay. How roughly does it cost, just for the sake of the knowledge?
It depends on where you do it. In KNH, it will cost between 300 and 500. In private, anything from 1.2 to 2 million.
Okay.
The good thing is that nowadays NHIF takes care of part of the cost, so it's it's something to consider.
Okay, that's nice. Yeah. Is there a permanent treatment of polycystic kidney disease, and how do you deal with the side effects, and who are the specialists one should see in the management of the same?
Yes, polycystic kidney disease is where your kidneys have cysts in them. Cysts are fluid-containing sacs. Now, in majority of people, polycystic kidney disease, we just watch them. We don't do anything because they don't cause any problem. However, those people are more prone to things like hypertension and infections. If that happens, you treat the infection early, you control the hypertension, and you can live with polycystic kidney disease. If it becomes a problem, then surgery or transplant might be the way to go.
Okay.
Yeah.
Okay. Thank you for that. I don't know whether there's anyone who has a question. You can raise your hand and give an opportunity to ask your question before we go to the summary of what the doctor has taught us tonight. Anybody wants to ask a question? I can give permission for that. Okay, well, for those who joined us during the session had already started, Doctor took us a few things that you need to know about kidney management. And he started with the functions of the kidney so that you understand what kidney do to our bodies. One, they do regulate our blood volume and composition. They also regulate our blood pressure, and they also regulate our pH, homeostasis of the blood. There are causes of kidney disease. We have infections, we have dehydration, and we have infection. On the part on chronic kidney diseases, this is common to people above 60 years and people who have diabetes and have a family history of kidney diseases. There are symptoms of kidney disease when you can know that you're having a failure in your kidneys. Mostly there are no symptoms, but when you start to see the symptoms, it shows that you're already in the early stages of the failure of the kidney. One, you notice that you have reduced urine. You'll also have swelling of hands, legs, and face. You'll also feel very tired, lose appetite, have headaches, vomiting, and severe itching to some of the people. In the stages of management of the kidney diseases, we have the primary prevention. That is, if you're having diabetes, hypertension, it's good to go for checkups to manage those conditions early. We also have early detection and treatment that should be able to manage the kidney disease. We also have the tertiary prevention, that is whereby we'll have the kidney transplant or dialysis to be started on you. Some tips on how to care for your kidneys is: one, you need to eat healthy. Two, avoid alcohol. Three, you also need to avoid the over-the-counter medication, because some of the medications like Brufen, they contribute to the kidney failure. And you also need to know your kidney family health, whether there's anyone in your family who has been having the kidney disease. On the tertiary treatment, we also have to do dialysis, which can be short-term or long-term. Kidney transplant will be done when you are in the final stages already, and it has a long-term solution for those who already their kidneys are failed completely. It is very expensive. And one thing also about the kidney transplant is that there are challenges of getting a compatible donor. On the significant contributors to the kidney disease, we have hypertension. So people with hypertension, it's good that you monitor your blood pressure so that you do not have a chronic elevation of your blood pressure, which will contribute to you having a kidney failure. Also, for patients with diabetes, it's good you monitor your diabetes so that you do not get to a situation whereby you don't have inadequate or you lack enough insulin, which contributes to yourself having a kidney failure. So something to take home is good that you do medical checkup oftenly. If you have a medical cover, it's good you utilize your outpatient medical checkup so that we can rule out or detect any problem that is coming up in your body and you're not aware of. So we thank you for joining us this night and hope you've learned a lot about the prevention and management of kidney disease. The good thing is it's good you can prevent what you already do not have before you get to a point that where we say, no, you've gone to the last stage or the fifth stage of the kidney failure. Our doctor can be found at Upper Hill Medical Center at the 4th floor, room 4C, and he has displayed the contact where you can get in touch in case you want to follow up or in case you have someone who is having a kidney disease. It's good you can get in touch with Dr. Boniface Mashira and he'll be able to guide you on the management of the disease. Thank you very much. Dr. You can see there are some questions that have come in, and since we still have some time, I think it's good you can answer the questions. Hello, Dr. You are there?
I'm still here.
I can see that. Yeah, sorry, you're muted. So we have a question. I think it's good you can just answer them since we have some time.
Yes.
You can advise about too much alcohol. Some was advised, I said you advise about too much alcohol. How that's control the kidney disease.
Alcohol is a tricky one, but we usually advise that for men, you should not take more than 2 to 3 units per day.
Mm-hmm.
And units in terms of beer, spirits, or vodka and wine, they vary. So if you're taking 2 small glasses of wine for men, that's enough. For women, it's half because they're not able, the body is not able to handle more than that. So if it's 1 glass, if 1 beer or 1 unit of alcohol, that is 30 ounces of vodka. The challenge we get is people take those units multiple times, or they use a bigger measurement. So if it's a glass of wine, they use the big glasses. If it's a glass of beer, then they use the big glass. So we like to be specific. 300 mLs for beer and 250 it's 200 for wine. And those are the units
for
we
wine.
use.
That's how many bottles? How many bottles? Because it's Friday.
A third of a bottle. A third of a bottle.
So you should not take even a full bottle. Okay.
Not even half.
Mm-hmm.
Yes.
No. Okay. How dangerous is it when a child gets UTI and treated like 2 times in 4 months? Is the medication harmful to the kidney?
Most of the medication we use for treating UTIs is very safe. But the question is, why are they getting the recurrent UTI?
Mm-hmm.
Especially for a child, we need to investigate whether it's a wrong method of toileting or why do they have another congenital condition? Why are they getting the recurrent urinary tract infection? That is very important. Most of the time, you just find it's how they are toileting, and they need to be shown how to do it properly. But most of the medicine we use for UTIs, it's very safe in children. Of course, there is a fear of resistance, so we don't want to keep treating the child many times. Yeah.
Okay. How about patients who have to use opioids?
Opioids, I assume we are talking about pain management. Opioids are safe for the kidney, but they tend to have other side effects. They are addictive in most cases. They cause constipation, they cause drowsiness, and some, like tramadol, cause a lot of vomiting. But in terms of direct injury to the kidney, no, they are not. However, when used long term, people tend to get tolerance. Then you have to use higher doses. Then those doses, higher doses, have more side effects, and indirectly you can affect the kidney. But if you're able to use them in moderation, they are safe. Thank you.
Okay, thank you for that. Does blood pressure medication cause damage to the kidneys, hence leading to the kidney failure?
No, actually, most blood pressure medication protects your kidney. There's a yes, it does. You'll find that drugs like what we call ACE inhibitors, ARBs, things like losartan or naloxone, they actually protect your kidney. And we use them in diabetics to control protein loss. So if a diabetic patient has protein in urine and they are not even hypertensive, we are going to put them in on an antihypertensive to control protein loss. So they actually protect your kidneys. What damages your kidney is poorly controlled blood pressure.
High blood pressure. Yeah.
Yes.
Okay. The intake of insulin or any other long-term drugs for chronics, how then does one manage to keep the kidneys safe?
Insulin is safe for the kidneys. There are some drugs for diabetes that have been shown to have some risk for the kidney function. But all in all, you'll find that most of the time it's not the drug that is causing problems. It is poor control of the condition. So insulin is very safe for your kidney. Things like glucophage are safe for your kidneys. Things like diamicron or amaryl are safe for your kidney. So you'll find that those drugs do not have direct damage to your kidneys. But when your blood sugar is not well controlled, definitely you're going to damage the kidneys. Yeah.
Okay. Is a child who had a stricture and operated on more prone to kidney disease at a later stage?
If the stricture was addressed in time, no, they are not prone. What happens is that sometimes by the time the condition is discovered, it is discovered when the child is very sick. Maybe they have a severe infection, what we call glomerulonephritis. So even when they heal, that kidney is at risk of, if the person gets hypertension, then it's a kidney that is at risk. So it has to be very well controlled. But if the stricture is detected very early, when there is no damage to the kidney at all, then there is no risk. And even then, the kidney, even when the kidney has a little damage in childhood, it tends to recover fully. It's only later in life, when you probably get diabetes or hypertension, that now your kidney gets damaged.
Can we have a situation whereby both kidneys can be damaged?
When we are talking about kidney failure, it means in those stages, it means the kidneys are affected uniformly. However, I can put it in another way. Can we have a situation where only one kidney is damaged? Yes. We can have a situation where only one kidney is damaged, like if you have obstruction of the ureters on one side, or you have trauma to the kidney on one side, or the infection predominates in one side. But when the kidney starts failing, usually even the good kidney gets affected. But in majority of cases, kidney failure affects both kidneys at the same time. Yeah.
Okay. Yeah. Can hypothyroid long treatment affect kidneys?
Hypothyroid drugs is usually thyroxine, which is basically supplementation of the thyroxine that your body is making. Normally, we all make thyroxine in our bodies. And that thyroxine has its function. So when it's low, we say you have hypothyroidism and we supplement it. So it's fairly safe long term. And if the hypothyroidism is also not treated, then it will give you other challenges which can affect the kidney. So it's safer to take the drug. Yeah.
Okay. And for someone who is at the last stage of the kidney failure, can that be reversed if the blood and they both have blood pressure and diabetes? If that is controlled, can that be reversed, or when it's the last stage, it's in the last stage?
The last stage is not reversible. The changes that have occurred are not reversible. However, some people are able to delay dialysis for a while or for a very long time if they are making urine and the conditions are well controlled. But I must say that usually when you're in the last stage, it's also very hard to control pressure and diabetes because their metabolism of insulin is also affected in kidney function. And chronic kidney disease also tends to push your blood pressure up. Unfortunately, also the accumulation of toxins, as much as you may want to delay, start causing other problems to the heart and the brain. So we normally prefer just to do dialysis to save you from all those other problems.
Okay. Okay. What is the lifetime with someone with a PKD, and when can you propose someone to undergo transplant?
Of course, CKD tends to affect the lifespan of a person. It is said that they tend to reduce 5 to 10 years. But if it is addressed on time, then the lifespan of a person goes back to normal. When we have established CKD, and we know that the kidneys are damaged beyond repair, the earlier you undergo transplant, the better. That is because dialysis also has its own problems. And we don't want to do it for a very long time unless we don't have a choice. The quality of life for a patient who has undergone transplant is much more better than a patient who is undergoing dialysis. So if you're on long-term or lifelong dialysis, if you get a donor, the better for you. And you should do it, if you're able, you should do it as soon as possible.
Okay, thank you for that. Can sulfan 5 mg used for a long time affect the kidneys?
Sulfan is a drug that we use to control bladder irritability, where a patient passes frequent urine, they don't have an infection, and the what we call overactive bladder. It's a safe drug because it just relaxes your bladder muscles. However, if used on long term, of course, it can have other side effects on the body because it has what we call antimuscarinic effects. So you'll have dry mouth, muscle fatigue, and all that. So we like to use it for a short time until the bladder has a tendency to learn and start behaving normally. So ideally, you should not have to use it for a very long time unless we don't have another choice.
Okay.
Yeah.
Okay, thank you for that. Before we conclude, apart from the people with chronic conditions like diabetic and hypertension that contribute to the kidney failure, for those already who have not been, they have not been detected with the kidney failure, what diet could you recommend, or what guide would you give them so that they can avoid to get into that situation?
There's no drug that is used to anticipate kidney failure. What you do is you control the risk factors. So there is no drug that you can take so that you prevent kidney failure. What you should do is make sure you don't get diabetes, don't get hypertension, don't get uric acid. And if you get them, let them be controlled.
Okay.
Yeah.
Okay. For those already with kidney diseases, what food should you recommend?
I think we will tackle that.
Yes.
Remember, kidney disease, if it is acute, which it's able to be reversible most of the time, so there is no diet changes. If it is chronic kidney disease and you're not yet on dialysis, then reduction in protein intake is very important, and sodium, that is salt. However, it doesn't mean that you completely go off protein. You still have to maintain a healthy diet because the body needs those protein for other functions. So you just minimize.
Okay. Okay, thank you for that, Daktari. We really appreciate for taking your time and educate our members about how they can prevent and manage the kidney diseases. For those who joined us from our social media pages, we really appreciate for that, and we wish you a very wonderful night. Take care of yourself and manage your diet as you've been advised, so that you will not get to the situation whereby you'll say you're having a kidney failure. Thank you very much, and we wish you a lovely night.
Thank you.